event. And we are used to that in our new ways of working. I hope you all have your consent for recording, those who are online. My name is Alan Maleche. I work for an organization in Kenya called Kelvin that focuses on health and human rights. And today we are really privileged to be part of the Digital Health Rights Project that is welcoming you to a discussion about overcoming barriers to digital health and protecting human rights. You may already have gotten a copy of the report that is speaking on the prevention on online harm. We are grateful for the good size of the crowd here, very many partners, allies, familiar faces, and people who are supportive of the cause of this work. I will go through the logistics of just the people online and the people in the room, and then we'll get straight to the action. So allow me to read this so that I don't get it wrong. So let me start by saying the Spanish and Vietnamese interpretation, and those are available. For those who are on Zoom, there's a globe that you have to click on to be able to access it. But for those who are in the room and you have a phone and you have your own headphones, you could scan the barcode and you'll be able to get access. There's connection to the internet, and the password is available on screen, but also on the wall in case you need to be able to connect, so that we ensure everyone is part of the conversation, both online and in the room. And while you're busy scanning the codes and figuring out the translation, let me just give you a quick overview of what to expect for the next hour or so, and what our exciting plans are this afternoon. Of course, we'll begin with online opening remarks from our colleague, the Secretary of Information and Digital Health of Brazil. She was unable to join on physically, but they have graciously done a video. We will then hear from the UN Human Rights Office. Definitely we'll also hear from young adults, because we are all about meaningful participation and having those who are actually affected being part of the conversation. And that will form our first level of conversation for the panel. Our second panel, which will be future discussions with experts from WHO, from the Ministry of Health in Thailand, and including discussions with the audience. So at any point, we also want to get to involve you into the conversation as early as possible. And then we will hear a brief spoken word in performance by one of our community and youth members through a campaign we are going to officially launch at the end of this session, which is called Make It Safe. And then we'll finally get online closing remarks from our co-sponsor, UNDP, who will be able to take that. So after all those conversations, we will be able then to have a social session just right outside here for a few light snacks and drinks before you call it a day and get ready for another breakfast meeting elsewhere tomorrow morning, as is the nature of World Health Assembly. So that's what we have planned. I hope it goes according to plan. Sometimes things change, but we hope to stick to that plan. But I think for me, it's very exciting to have a different mix of colleagues in the room, from social scientists, communities, of young people, government officials, technical colleagues from the UN, colleagues from across different parts of the globe, working on different areas of health and different areas of human rights, governance, and democracy. This is a very exciting event, and we are really excited to take it off. So without further ado, I will first of all get us started with a video from Ana Estela Haddad, the Secretary of Information and Digital Health of Brazil. Once we finish from the video, we will then hear from Mr. Shalev from the Office of the High Commissioner of Human Rights, and then we will move on to the next session. So could you please have the video?
I would like to thank Professor Meg Davis for the honorable invitation to this so important event and I would like to apologize of not being able to be personally there with you. So since I was introduced to the Professor Meg's Digital Health and Rights project, I have been very impressed about the quality and relevance of the research. The project reinforces the idea that digital health should be designed to promote and protect human rights. Digital health is not just a technological advancement, but a crucial tool for ensuring equitable access to health care and dignity. When effectively implemented, digital health can help bridge long-standing gaps in health systems, particularly for marginalized and unserved populations. Digital health needs to address the systemic barriers such as social and gender inequities and low digital literacy. Furthermore, it must be approached as a cross-cutting issue that intersects with other fundamental social rights. Health outcomes are deeply influenced by the social determinants of health, and in the digital age, we must now also consider the digital determinants of health, such as access to device, connectivity, and data privacy. Governments and society have a responsibility to actively confront and reduce digital exclusion and digital violence. The Ministry of Health of Brazil is committed to the integrity of information and the promotion of quality public health, is implementing initiatives to combat social inequities and promote digital accessibility and rights. Our ministry has created the Secretariat of Information and Digital Health and has developed the program that we call Digital SUS, SUS Digital, whose main objective is to drive digital transformation within the unified health system, our SUS, Brazil's public health system, that is completely free of charge and is responsible for 70% of the Brazilian population. One of the program's fundamental axes is promoting the culture of digital health, together with training, digital literacy, and continuing education in health. The program provides a financial incentive for Brazilian states and municipalities to develop their digital health action plan. This federal funding of $80 million was designed considering essential social and equitable criteria and was the first federal resource allocated to this transformation of digital health in the country. Through the Digital Health Program, the National Health Data Network is also being strengthened. The Health Data Network is a national interoperability platform that aims to promote the exchange of information between points of healthcare network. The Health Data Network information is made available through an app, a platform that allows citizens to access their health information in the palm of their hand. It's the Ministry of Health duty to support vulnerable communities, including indigenous, riverside, and quilombolas, which often face significant barriers to healthcare access due to geographical isolation and limited infrastructure. Let's ensure that digital health is designed to serve people, respect human rights, and promote the well-being of all. Thank you very much. I would like to
Indeed, thank you to the Secretary Ana Estelda Haddad for sharing those powerful insights. From Brazil, I think it's something that we all desire. Many governments would take a similar direction in terms of promoting the culture of digital health and also doing it in a way that looks at the most marginalized, most vulnerable, and ensuring services get to people. So thank you for those remarks. I will now formally call on board Mr. Shalev, the Chief of Equality and Non-Discrimination Branch of the Office of the High Commissioner for Human Rights, to share his opening remarks. Please welcome. I'm sorry you're alone at the front, but I will. Sure.
You can just move forward a little bit, if you don't mind, so we can meet you.
Okay. So, dear participants, colleagues, friends, it is a privilege to join you today for this event. I would like to start by thanking the Digital Health. I would like to thank the Digital Health and Rights Project. Thank you for inviting us. I think this conversation is very timely and looks at the intersection between digital innovation, health, and human rights. The realization of the right to the enjoyment of the highest attainable standard of physical and mental health, as enshrined in the international human rights law, increasingly depends on how digital technologies are designed, deployed, and governed. As we all know, digital technologies offer enormous potential to advance the right to health. Telehealth can extend care to remote communities. Artificial intelligence-assisted diagnostic and wearable devices can enable early detection and disease management, and assistive technologies can enhance autonomy for older persons and persons with disabilities. Digital platforms expand access to health services and education, helping to bridge systemic. As non-communicable diseases rise and population age, integrating technologies across health systems will only become more essential for achieving universal health coverage. I was actually recently at the event at the Vatican on the older persons. WHO was there, by the way.
Sorry.
It's okay. So we are really assisting of transformational shift in this regard for all the persons. And I think this also could be taken into account during the discussion today. So these are all the benefits that we see from the digital technologies. However, the potential is not yet evenly distributed. Nearly 2.6 billion people still lack access to the internet and its related essential services, most of them in low and middle income countries. Beyond connectivity, digital inclusion is about also equity, safety, and participation. It is about closing the gap between the opportunities and exclusion for those most affected. Without having robust human rights safeguards, digital health technologies risk reinforcing systemic inequities and bias, particularly against groups experiencing marginalization, such as women, minorities, older persons, persons with disabilities. We heard also from the Deputy Minister, indigenous peoples, and so forth. The digital health transformation calls for a shift in how we conceptualize the role of technology in health systems. Rather than siloed manifestation, we witness a transformative process that permeates all dimensions of health intervention, systems, and underlying determinants of health. This shift impacts a broad range of rights, including privacy, the right to privacy, information, self-determination, autonomy, participation, education, non-discrimination, access to information, and so forth. For this reason, we believe that human rights should be an essential element which guides the development and deployment of digital health technologies. At the Office of the High Commission for Human Rights, we work to ensure that human rights are safeguarded across the many intersections of technology and health, and technology is explicitly considered and integrated in all our health-related mandates. This includes exploring how digital platforms can expand access to mental health services, emphasizing the importance of digital confidentiality in HIV care to prevent stigma and criminalization, and advocating for equitable digital supply chains and telehealth systems that are grounded in robust data protection to ensure access to medicines, vaccines, and other health products. The Office of the High Commissioner for Human Rights is also engaging with a new and complex issues. For example, our work on neurotechnology highlights how it's both has therapeutic promise, but also has implication for privacy and informational self-determination, autonomy, and human agency. Our work on artificial intelligence calls for rights-based approaches to regulation and clear safeguards for privacy and accountability. In line with international standards and recent recommendations, OHCHR has developed human rights indicators and assessment tools that can serve as critical tools for shaping and evaluating digital health interventions. Our work on digital technology was captured in our 2024 mapping report on human rights and new and emerging digital technologies. And this mapping report is available on our website. It highlights efforts across key thematic areas like digital privacy, informational self-determination, internet shutdowns, robotics, and assistive technology, among others. Central to our work on the right to health is the principle of non-discrimination. In an era shaped by the pervasive integration of digital technologies into everyday life, reshaping how we live, relate, work, and understand the world, special attention must be paid to the needs of vulnerable and marginalized populations. This growing digitality affects the ways in which inequality is produced, reproduced, and made invisible in a digitally saturated world. This is exemplified by the systemic and algorithmic invisibility of older persons and the rights posed for them by caregiving technologies when adequate safeguards are not in place. Innovation must never come at the cost of agency or dignity. Our office remains committed to work across the UN system, in particular with WHO and partners such as the Digital Health and Rights Project, and beyond, to ensure that digital health advances are inclusive, participatory, and rights-based. We also welcome and support research initiatives that are grounded in community participation and human rights framework, like the Digital Health and Rights Project. The recent study, Paying the Cost of Connection, provides crucial evidence on the lived realities of digital exclusion and technology-related harms. It is also a powerful reminder of the urgent need to center human rights in the digital transformation of health. The challenge ahead is not only technical, it is relational. Digitality is reshaping how people engage with healthcare, institutions, and information. Human rights-based approaches must therefore consider not just who has access, but how systems are designed to reflect, interact, and learn from these diverse realities. The future of health is being written in code and connectivity. Our task is to ensure that it speaks also the language of human rights. Thank you.
Thank you so much, Mr. Shalev. Again, another round of applause. It's definitely refreshing to hear commitments around grounding work in human rights, especially in the environment we currently are in. So that is very welcome, and working across UN agencies and with also partners. We'll quickly move on, and this time we want to bring the voices of some of the colleagues from Ghana, Vietnam, and Kenya. And so I'll turn it over to Juliet.
A small compound house in the microphone. Microphone is microphone up. Yep. In a small compound house, the desert in northern Ghana. That's the red light.
Would you mind?
Sorry, yeah. In a small compound house in the desert of northern Ghana, Lariba sits on a straw mat, weaving a basket, her children playing nearby. Her husband's words from the previous week still ring in her ears. What does a married woman need a smartphone for? What do you do on the internet? It's for men. Lariba is the third wife in a polygamous household with little say in the family decisions. Her co-wives nodded in agreement with him, convinced that the digital world is a space that they do not belong to. Lariba knows differently. She once borrowed her friend's smartphone and saw online resources on women's health, women's rights, and small business ideas. She could see the possibilities, but her dreams seemed unreachable. On the other side of the high wall of gender inequality that keeps her deep in the shadows of the digital age.
In a sprawling electronics factory in Vietnam, working alongside hundreds of women, Huang leaned over a conveyor belt, her fingers flitting across circuit boards. Factory fumes stung her eyes. She says, "It all started when I had a nosebleed. This is a common side effect of exposure to chemicals. But by lunch, people were whispering along the assembly line that I have HIV. Within hours, the lie went from the factory floor to Facebook and a chat group on Zillow. It went far beyond the factory. People in my community avoided me. I complained to the supervisors, but they cared more about production quotas than they did about me. When I reached out for a tool in the factory, other women moved away. Men called me names. The local health department even got involved. I told everyone I was HIV negative, but the damage lingered. Truth does not erase shame."
Zoe is a 27-year-old woman in the first focus group discussion of the study. With other women living with HIV in Nairobi, she says, I quote, "Countless times I have gone to Google, have gone to YouTube to look at things that I want to know about. I think this cuts across everyone, even someone who doesn't have HIV, but has a migraine, needs to access information. We know everyone has their own issues going on. I think Google and digital health apps can do more to protect our information. Because when you put your information out there, number one, it's because you feel like you trust them. I think they should be firm and stick to their rules, maintain that trust. Because why should I come to you if I know you're going to rat me out? It's like when I came here today, you gave us the consent forms to go and read. It said, we are asking you to be part of our research. So now I know I'm part of a research study that explores young adults' experiences with how digital technologies and online platforms are governed. I felt safe I was like, okay, we are dealing with something that I understand. Because you told us that we are the first ones. There will be more 16 groups in Kenya and 3 more countries that after. I was like, man, may the objective of all this research come to pass. Let me see it happening. I hope that we get to understand what the governance of information is, because I sat and I thought, okay, so we have rights. This is what we are supposed to be getting as a human, as an adult, as a youth, from the internet, from the government. So yeah, I think it would be pretty good if everybody knows it. End of quote.
Thank you so much, Egla, Salman, and Juliet, for reading those moving reflections from our colleagues from Ghana, Vietnam, and Kenya. And we definitely agree that everyone needs to know their human rights in every way possible. Because we need to make time, I will quickly move to our first panel, which is composed of Meg Davis, who's a professor at Warwick, University of Warwick, on digital health and rights. She will be presenting the findings of the study very briefly, and then followed by Molly Jones from Stop AIDS, who is the advocacy director, who will be speaking to the recommendations. And finally, we will get to hear from Simon Sylvia from Ghana Community Advisory Team, who will be bringing in the voice of the Community Advisory Team and what their reflections are. So I'd like to welcome all 3 of you. I'll start off with Meg and then Molly, and then hopefully you'll all be at the front. Please feel free to use this.
Thank you so much, Alan and colleagues. It's really a pleasure and an honor to represent the Digital Health and Rights Project and to share our research findings. My name's Meg Davis, professor at University of Warwick, but I'm here speaking on behalf of the whole consortium to share the research findings with you. And this location feels especially relevant, and I think Alain Lebrique pointed it out in one of our initial calls, that we're just down the street from a safe injecting site. We're close to the leading sex worker organization in Geneva. We are near the red light district. We're close to the communities that we work with, and that's exactly where we feel we should be. So thank you for making the journey and finding us here today, and we're excited to share these findings with you. And the report was available on the back of the screen and will also be available for download at the digitalhealthandrights.com site. As background, I want to frame the context a bit, and just to point out that we have growing youth populations in each of the 4 countries where we work, with over 20% of the Vietnamese population between the ages of 18 to 30, 29% in Colombia, and larger percentages in Kenya and Ghana. Can you hear me okay? It's a little noisy. Yeah, that's all right. Good. But those growing youth populations, of course, are super engaged online, but don't all have access. And in particular, we note that 97% of young people in Europe use the internet daily, but that number drops down to 60% of those who are employed in Africa and fewer than 45% of those who are unemployed. And for young women in particular, we know from our previous research as the Digital Health and Rights Project that young women often become resources for peers, family, friends in the community when they access health information online, but they have less access than their male counterparts. And so as a consortium, we're really keen to understand the mixed and complex realities. As adults, we can hold conflicting ideas in our heads. We can believe in tech for good, and we can also understand that there are challenges and barriers as well. And so what are those realities for young adults in low and middle income countries? As a consortium, we came together from 2019 as a Digital Health and Rights Project at the request of civil society leaders on the board of the Global Fund to Fight AIDS, TB, and Malaria to understand, gather empirical data about the realities of the digital transformation in low and middle income countries, but to do it using an approach that really builds capacity for national civil society organizations, peer-led networks, and universities in each of the countries where we work. And that was the mandate we were given. And so we came together as a highly collaborative group. There is nothing you see from the Digital Health and Rights Project that has not gone through extensive review and sign off from just about everybody in the consortium, and that's how we like it. So it's a very collaborative, cross border learning partnership with field study exchanges, leadership training, mentorship, coaching for rising managers, and support across the consortium. These are a few of our previous publications, and including publications in BMJ Global Health and numerous other peer-reviewed journals. They're all available on our website. Since 2021, we've engaged over 600 young adults in 5 countries, and you'll hear findings today that are new, but that are very consistent with our earlier findings. We're seeing really overwhelming evidence of the issues we document, and we feel that there's really no longer a need for research on most of these issues. We have evidence, and now we need to act based on the research findings, and that's what we hope to start a conversation about today. But I also wanted to flag some of our joint collaborations. For instance, this partnership with the World Health Organization's Digital Health and Innovation Department to review national digital health strategies and analyze how they considered gender inequalities, human rights issues, data governance, the diverse populations in each country. And we found some diversity across the 20 strategies, but we found, to our surprise, that there was very little discussion of gender and no objectives to address gender, the digital gender divide, that rights were generally overlooked in most of these strategies. Only one, actually China, was the one that actually really did consider diverse populations, but the others really had not. And only one, Ghana, had included some consultation with civil society. And so we feel that this can be improved. And we've been in ongoing discussions with our colleagues at WHO about ways to do this. Likewise, Stop AIDS has a new report just about to come out any day now, based on their review of 7 overseas development assistance donor strategies and policies on digital health, digital literacy, and human rights, and found very limited prioritization and tracking of digital health investments, which I'm sure we would like to see more data on, but also little consideration of human rights concerns in their investments. And so, again, we really want to call on our donor colleagues to think about not just getting tech out, but also what are some of the challenges and barriers that brings with it. So I encourage you to check out the Stop AIDS report, which is coming very soon. So this particular study drew on all those literature reviews to identify a series of questions to understand some of the human rights considerations for young adults. And we developed these questions again across our full consortium, including consultation with diverse communities, with a focus on how different kinds of digital divides intersect and overlap to deepen exclusion or to shape inclusion for certain groups, how criminalization and stigma specifically affect communities living with and affected by HIV, including those who are criminalized in some countries where we studied.
Yes.
The different kinds of digital literacy young adults say they need and want in order to empower them to participate in the digital transformation, as well as because our collaboration, our consortium includes the global network of people living with HIV and 2 national networks and NGOs that have engaged on HIV as part of the response for years. What are lessons we can learn from that movement and from that response to inform future mobilization and advocacy, and to help us think creatively and collaboratively about the future of human rights in the digital age? We chose to use a participatory action research approach, which is when the study participants not only participate in designing the study and gathering the data, but also validate the findings. So we took the findings back to study participants and asked them if they thought we had gotten it right in each country. And then we asked them to lead advocacy. So in each country, we have a community advisory team. And I'm just going to ask our CAT representatives to raise their hands in the room. We have 4 CAT representatives here from Colombia, Ghana, and Kenya. Sadly, our Vietnamese colleague got their visa application denied, which is very unfortunate and unlucky for us, and reflects some of the inequalities that shape global health and human rights meetings in Geneva. Nonetheless, our other colleagues are here to represent the communities that are part of this study and who will lead the advocacy nationally and globally with support from Stop AIDS and Privacy International in the future. We conducted qualitative research because we really wanted to get a little bit deeper below the surface than you can get in a survey, and to work with smaller groups to probe some of the inequalities and how people experience them in their daily lives. We held focus group discussions and key informant interviews in multiple locations of each of the 4 countries where we work, rural areas, peri-urban, and urban areas of each country. We had national research led by the national NGOs, networks, and universities in each country, And they also traveled to support each other. So the Kenya researchers went to Ghana to help the Ghana researchers and vice versa. So we had some nice collaboration across countries with support from myself and from a postdoctoral research fellow and research assistant who's manning the computer right now, across to support all of the national teams and ensure that the research was clean and comparable and ethically conducted. This gave us 4,000 pages of transcripts in 6 languages: English, Sheng, Spanish, Swahili, Tree, and Vietnamese. And this was all translated into English, and we had a 6-month process of collaborative analysis, which was very rigorous, using deduce, and I'm happy to answer questions about that if people are interested in geeking out on methods. This generated focus groups of 302 diverse young adults in the 4 countries, ages 18 to 30, which is an age range we agreed on as a consortium because each country defines young person a bit differently. They all had primary education, some had secondary, and a small number had tertiary. And they included people living with HIV, sex workers, LGBTQ+ people, and rural women, especially in Colombia. And as you can see, we asked them to identify their gender identities, and that gave us 7 gender identities. So this was a group that identified themselves in diverse ways, and we respected however they identified themselves at the local level. 27% rural, and I think that's quite significant because I don't think there have been many studies of digital transformation of health with young adults in rural regions really talking about their experience. So that's what we did, and here is briefly what we found. Overall, across the 4 countries, stigma and concerns about data privacy protection was a shared concern and was the top concern across all 4 countries. And in particular, young adults told us, we asked them as the first question to the focus group, we gave them Post-it notes, and you saw a picture of those earlier, and we asked them to say, what's the biggest barrier you face to accessing health information on your phone? And a surprising to us number across all 4 countries said privacy and stigma. And a lot of this had to do with fears of concerns about how health apps and digital health platforms govern their data. A lot were using social media to access health information, concerns about the sale of their data to third parties, including by telecommunications companies. And in particular, given criminalization in Ghana, young adults were very concerned, justifiably, as we learned, about vigilante violence and fears of surveillance and harm related to the anti-homosexuality bill. And this created a certain amount of hesitation, fears, anxiety about going online to search for and share health information with others because, in fact, people really didn't have basic information about data protection. What is being done with their data? Where does it go? Who stores it? And how is it governed? And what could they do if there's a breach? And this information from most of the people we talked to was missing. And I think that's an important gap that we can talk some more about. But there were differences across countries. And so this was the top concern across all 4. But in each country, the concerns were slightly different. And so in particular, I want to highlight that in Kenya and Ghana, the cost of getting online was a significant concern. And often when I talk to people about digital health, people in cities, they say, oh, everybody has a phone, even in villages, even the guy who sells me chapati on the street has a phone. That's not actually true. What we found is that a lot of the young people we talk to cannot afford a phone, especially cannot afford a smartphone, and have to share phones with family members, partners, or friends. And in particular, in Kenya, we learned about something that we call the mobile debt spiral, which is where a very well-intentioned initiative to offer microcredit to help people get airtime when they run out of airtime so they can continue to get online because Wi-Fi is not widely available. So people are taking 500 shillings, which is 10 to 12 US dollars, and taking that in debt. But then when they can't pay it back, their phone is locked. And then they can't access ways to generate income, especially if they work in the informal sector, they're traders, or they're sex workers. Their income stream shuts down when they don't have phone access. That means they then borrow money from other people in order to pay off that debt, and that lands them into a deepening spiral, which can be quite harmful, and especially for sex workers can lead to unsafe employment for some. As a result, therefore, many people were sharing devices, and that meant that others in their community, family members or friends or partners, were seeing their text messages, were seeing their browser searches. Sorry, this is distracting me. I might not be distracting you, but I can barely hear myself. And so therefore, they were feeling extremely vulnerable in terms of their privacy. And this links to this concern about stigma. And I want to highlight that young women talked about this more than men in those two countries. And so we really understood that young women were quite seriously affected, and that even efforts to remind women to, for instance, access care or services, refill prescriptions, could expose them to the risk of harm and to the risk in this particularly quite tragic case of being evicted from the home at the age of 14 years old because her status was revealed to her family. And thus, we thought we were going to hear that people were concerned about police surveilling them online, but actually most of the young adults we talked to were much more concerned about family and community surveilling them online, and that this intersected in some cases with criminalization, with fears of vigilante harm, of community members engaging in sort of policing of their behavior, as well as these concerns I mentioned earlier about privacy. The most disturbing concern, and this is the one that has gotten the attention of the media, I think more than anything else that we've found, is that 3/4 of our study participants described technology-facilitated abuse against themselves or their peers. And this included just about every form of abuse that has been categorized in the UN definitions of technology-facilitated abuse, ranging from harmful language and abusive comments, particularly targeting people living with HIV, young women, LGBTQ+ people, sex workers, and concerningly HIV peer outreach workers. So people who are going online in the public interest to share health information with others, to say, get tested for HIV, get on treatment, it can save your life. Those people are being targeted with harmful abuse online. We heard many reports also of blackmail and extortion, particularly for those who are criminalized. Stalking, of course, non-consensual porn, this has been widely documented. And we also saw that online abuse could move to offline and back to online. And there were numerous cases of this, particularly reported by sex workers and webcam models in Colombia and other countries, but also against sexual minorities in Ghana. And in one case, a young man who had ongoing communication with a potential romantic partner for 6 months, and then was lured into an ambush with some people who had machetes and sticks and who attacked this young man. That was probably one of the more serious abuses we documented, but there were numerous other cases that people had heard about or had shared with us. And the overall cumulative effect of this, many young adults talked about internalized self-stigma, such as in the incident we heard described from Vietnam, but also forms of self-harm, either by themselves or peers, and that was very concerning. We had ongoing referrals to clinics for young people who participated in the study, but there's clearly a huge gap in terms of response for young people who experience technology-facilitated abuse. And so many of the young people we spoke with, particularly in Colombia, Ghana, and Kenya, did not have much faith in reporting harm either to social media or tech platforms or to the police. Particularly those who were in Colombia and in Ghana said they had had quite harmful experiences with the police that made them reluctant to report to the police. Surprisingly to us in Vietnam, and encouragingly, actually, young people in Vietnam said they had more hope that they could report to the police and the police would take action, and that the legal system had some standards in place. And that was quite encouraging. But that was different from the other 3 countries, I would say. Overall, what we saw was overlapping inequalities that really undermined the promise of digital health for many of the young adults, cost barriers, challenges with navigating misinformation and the information ecosystem, concerns about data protection, gender inequalities, and the threat of abuse that together undermine the access and the promise of digital health for many of the young people who participated in our study. I do want to give us a little bit of note of hope, and that it also comes to us from Vietnam, where the community advisory team, which is made up of leaders of networks of people living with HIV and key populations, came together when there was this incident of a social media post which denounced a young woman with her photograph for having transmitted HIV to 16 sexual partners who worked at her company, an international electronics company. This was false. The Vietnam Community Advisory Team came together. They got in touch with the company, with the local Center for Disease Control, with the police, and they got active on social media in solidarity with the people who were being harmed and said, this is misinformation, please stop spreading it. And they managed to have a positive impact. The police got involved. They did detain and fine one of the people who'd made that social media post. And I think the Vietnam Community Advisory Team saw this as a potential model. This is, again, an example of how the network of people that has been built up in response to the HIV epidemic have come together to mobilize and advocate in solidarity with others. And I thought that was a really encouraging example and a model for us to think about. Many of the young adults, despite all of the concerns and the issues, were enthusiastic about the digital transformation, very keen to be involved. We saw a very strong interest in digital literacy, particularly in person, which was interesting, and in getting trained, especially to better understand AI. There's a lot of interest in AI, although also some mistaken beliefs about AI, but definitely some excitement about the changes that are happening, but also calls for the future to be better governed and more transparent and accountable. We've established an online digital empowerment hub with over 200 tools for training and for use in workshops or in self-paced learning on digital human rights. And we encourage people to check it out and share with others. And we'll be using these in the future. But in conclusion, we see, as I mentioned, overlapping inequalities, some really intersectional divides that really need to be addressed with targeted interventions. And we believe with young people and civil society at the center of designing those things so that they really meet local needs. It's no one size fits all. We see a need to address these concerns about criminalization and stigma and technology facilitated abuse really demand urgent action because this is affecting not only young women, also young men and trans and gender diverse people. And as I mentioned, HIV outreach workers who I think should be considered human rights defenders, and as we think about the response. And lastly, I want to emphasize the need to continue to invest in community-led response because that groups on the ground are continuing to lead that response. With that, high-paced speed through our findings, and now pass over to Molly Few-Jones to share the recommendations.
Thank you, Meg. And firstly, thank you. It's fantastic to see such a full room. So we're really pleased that you're prioritizing digital health and human rights this evening. So we have a fantastic evidence base for us to conduct some amazing advocacy over the next year. We have a great advocacy team supported by the community advisory teams in each of our 4 countries. And in the report, we have built on those research findings, and we have a series of recommendations. I'm going to speak to them briefly today, but you can take a report from the back or a summary of our recommendations, which are aimed at a range of actors from national governments, technology companies, international organizations such as those present with us today and speaking on the second panel, as well as communities and those working in community-based organizations. We took a transnational participatory action research approach to developing the recommendations as well. So we continued that approach. We consulted with our community advisory teams, with the research participants and experts within our consortium to distill the evidence that we had gathered into tangible, targeted recommendations. So as I said, I'll briefly share those with you today, but please do go and take a look at the report available at the back or online. Next slide. So we have 4 key themes running through the report. The first is digital inclusion. And here we're really encouraging stakeholders to center human rights and ensure that digital inclusion is a key priority, thinking across those intersectional challenges, including social, economic, geographical barriers to inclusion and digital access. We'd love to see stakeholders committing to also providing non-digital access and remembering that many people remain offline or facing challenges to accessing digital health. So one of our key recommendations is to maintain non-digital services for those people. And finally, we'd like to see key stakeholders, including the WHO, take forward recommendations from our report on gender equity and human rights, and to embed those in digital health strategies at a national level. When it comes to technology-facilitated abuse, we are really encouraging stakeholders to consider how we define and conceptualize this term. Our research demonstrated that this goes much broader than women and girls, as is currently defined. We saw abuse affecting queer populations, people living with HIV, transgender people, sex workers, and as Meg mentioned, importantly, human rights defenders such as HIV activists and healthcare workers. We would like to see increased research, in particular thinking about disaggregating data to better understand how TFA is affecting people, the root causes of TFA, and how we can work together as multi-stakeholder bodies to respond to TFA and the many ways that it manifests online. We recommend a survivor-centered approach and grounding all of our response to TFA in a survivor-centered approach, protecting survivors' rights and ensuring that they have access to health services, mental health services, and access to remedy and justice. And we'd like to see key stakeholders such as UN and WHO develop technical guidance for member states so that we're better equipped to prevent and respond to TFA as an increasing and increasingly normalized issue online. When it comes to privacy, we're really centering this again in human rights and asking stakeholders to uphold and strengthen the right to privacy. We found that many young people are unsure of how to access redress or how to protect themselves online. So we'd like to see greater kind of impetus and energy towards making sure that the public are aware of their human rights and digitally empowering young people online. And we'd like to ensure that there are adequate human rights standards and due diligence mechanisms within public-private partnerships in particular when it comes to protecting the right to privacy. Finally, a key finding, as Meg mentioned, was the digital resilience of young people. And we really call on stakeholders to support that and to further that by ensuring adequate resourcing for digital literacy, digital empowerment, human rights knowledge and understanding, and also ensuring that young adults are able to meaningfully participate in digital governance. So we're hoping to demonstrate that today with the addition of our CAT members who are participating in the event. But we really feel like there are key opportunities, for instance, in the Global Initiative on Digital Health and the new and revised strategy on digital health at WHO level. And finally, we have some really exciting next steps for us to take those recommendations forwards. So in our consortium, we will be empowering and equipping young people with some digital empowerment training. We have an incredible library online, a digital empowerment hub, which pulls together existing resources. We've created an online curriculum that many people around the world can engage in. And we're also training our CAT members specifically on digital empowerment. We're going to be conducting some fantastic national advocacy and really making sure that we link that into our global advocacy with WHO, UN colleagues, and really equipping our CAT members to be part of that and to be leading the way when it comes to advocacy. That was incredibly brief, as I said at the beginning. Please do take a look at the recommendations in the report. And I'm very pleased to pass on to Solomon, who is a member of our Ghana community advisory team and an incredible activist in his community. So he will give some remarks. Thank you, Solomon.
Thank you, Molly. Good evening, cherished guests, colleagues, and community allies. So before you is a queer Ghanaian and a human rights defender who has long worked alongside LGBTQ+, sex worker, and key population communities whose bodies and lives are often criminalized, surveilled, and rendered invisible in digital spaces. In Ghana, through the Digital Health and Rights Project, we set out to understand how communities that are most affected by inequality, experience the digital transformation of health. And we uncovered amazing stories of resilience, but also painful with some pervasive harm. I recall one during the field data collection when one transgender person shared that because they are transgender and they are also living with HIV, they are always worried whenever they have to find health information online because they were scared and feared who was monitoring them and who will come after them. And so in Ghana, you realize that queer lives and other key population groups are often politicized and pathologized. And so a simple act of trying to get health information or find out health information or digital health information can place someone in a risk of being harassed, being exposed, and being blackmailed. So during the field data collection, we also observed that a particular participant shared, and not only one participant, several participants shared that they are often told that everything is online, yet they are not safe, and that online platforms are not safe, and their identities are criminalized, both in real life and online as well. And so in Ghana, we observe that the digital divide is not only about access, it is also about dignity. It is also about language. It is also about literacy. And it is also about protection. So you found out that there were a lot of, most of our participants had smartphones, yet they were unsafe using these smartphones to access information, including health information online, because they were worried about issues of privacy, dignity, and language. And so in Ghana, we observed during the Digital Health and Rights Project that misinformation other than verified health information spread faster. And it is even worse and pervasive within PLHIV, sex worker, and among queer youth. And I recall one participant sharing that WhatsApp chain message, which claimed that ARVs, antiretroviral drugs, could cause or can cause infertility. And this misinformation ended up preventing or stopping some queer persons and then some PLHIV who were on treatment to stop treatment entirely. And so in Ghana, through the Digital Health Rights and Project, we realized that issues of data privacy breaches, and digital surveillance by both state and non-state actors are normalized, and hence targeted online abuse is on the rise. But then I stand here and I share a message of hope. As a young man and as a person identifying and representing the very communities the Digital Health Rights and Project serves, I want to share that we young adults are not only victims of digital harm, we are also very innovative. Amidst the rise of targeted online abuse, we've also been able to find some encrypted WhatsApp platforms and other support groups, as well as some underground Telegram pages and platforms where we continue to share peer and other PLHIV-friendly resources and information. So what we are asking is that global leaders, governments, and digital platforms should stop leaving us behind. And so we are asking for a digital health future that does not trade our dignity for data. And we are also asking that AI and digital tools should be designed with us, for us, and by us. And we are asking to be safe to exist. We are asking to be safe to connect, to heal, and to thrive. And so we believe that digital health solutions and digital health solutions should protect the most marginalized. They should be assessed in trust, in safety, and in truth. And to end, I want to leave this for us, that let us all co-create a digital future where no one has to choose between their health and their future, where our right to exist is not a risk, but a guarantee. Thank you very much.
Thank you so much, Solomon. Very powerful comments. Because we are running a little bit behind, we're going to continue straight on and have a brief roundtable discussion, and then we'll move into some questions and discussions with all of you. So I now invite my colleague Cindy Ameza, who will be my co-chair for this discussion, Alistair Shaw from Global Fund, Dr. Alan Labrique from the World Health Organization, and Dr. Adichan Chuajinda from the Thai Bureau of Digital Health to please join us up front. And we have some slides, I believe, from Dr. Adichan, so maybe we can start with that.
And put the slides now, the other slides.
Thank you.
Oh, no, the other one, you remember the Thai.
Yep. Okay.
Yeah.
Yeah, I'm gonna sit on the edge there, so yeah, there we go.
This one.
Dr. Adichan. Yes. There you go. Oh, sorry. I want to move the side.
Okay.
So this presentation from Thailand is just the example of the online platform that Thailand is using this platform to service the people in Thailand. So this is just a field example that we use.
It's not changing. I'm going to.
Okay, this is of course at the DHRP said that the security and the data governance and privacy is necessary. We developed the health ID and provider ID to identify the user. That user can identify themselves to access their health data. So in Thailand we have over 60 million people that connect to this platform because we trust in the online platform according to these policies. So the policy is necessary. This is the function in each platform online that we can provide to our people, like online appointment, health record, medical certification, digital prescription, healthcare service, and so on. And lastly, we have about the health literacy. So that is people can know what the true message that is can inform to them directly. Of course, before we access to this page, we need to log in by the PIN code that you can know by yourself. So this is the way to identify themselves. This is another platform in Thailand. We call the Thailand Health Atlas. This platform help us to identify the key population in each area. So this digital transformation that is necessary to put the budget to the people. The people not need to have the smartphone, but we can go to the right people, the correct problem in each area by the government, like a palliative care stage, long-term care, elderly, like that. That's all.
Thank you very much. So, yeah, thank you. So we're going to now have a little discussion. Maybe we turn off the slides just so we can see you. And I'm really delighted to pass the microphone first to my colleague Cindy Ameza from the Kenya Community Advisory Team, who will ask the first question.
Thank you so much, Meg, and all the presenters.
Sorry.
Go.
Okay. So thank you so much for the presentations and for all the sort of summary of the report and the recommendations that have been provided. So, and I'm very delighted to have these panelists on board. And as we start, I would just want to ask if you can share with us some of the initial reflections on the findings and the recommendations that we have given you from the DHRP report. What needs to be done by us in our different spaces, in our different stakeholder spaces? What needs to be done? I would want to hear from each and every one of you. Thank you.
Okay. According to the question, I think that the DHRP report highlight critical issue that Thailand is also confronting. Digital health transformation is therefore a strategic tool designed not only to introduce new technologies, but to support and strengthen the healthcare system and address existing structural challenge. So we begin by designing the ideal health service in your own country, which then guide with the integration to the appropriate digital tools.
Can you? First of all, wow. I think that was a tour de force, and maybe deserves the round of applause again. Well done, well done, team. And then hearing from such eloquent speakers and representatives of the stakeholders that we serve. You know, WHO is a member state organization, so it's always the voice of the member states first, but there's nothing more powerful than the voice of the people, and you've really done a great job of bringing them to the forefront. So it's digital health is at the forefront of many conversations this week at the World Health Assembly. There's Meg and I were talking earlier. There's 26 digital health and AI events that we know of. So it's a hot topic, and I think without this particular topic being discussed, all of the other stuff doesn't move forward, right? Earlier this morning, we were talking about the things that we often see, you know, as funders, as international agencies, as researchers. We see the front end of things. We hear about the shiny objects and the exciting tools and the platforms and the frontline health records, but we often underestimate the invisible layer that makes those front-end tools work. And very often we talk about the invisible layer as the standard, the interoperability, the architecture, which are underappreciated. But there's another invisible layer, and that is design, the design of the systems, designing with intentionality and equity in mind. So I think you brought up the issue or the opportunity of starting with the digital health strategies, right? WHO has helped countries advance the articulation of their digital health goals and blueprints. And within those strategies, as we collaborated and found, there's a stark gap in addressing these key issues. And so one is making sure as countries renew their strategies and optimize those strategies, that equity, inclusivity, marginalized populations are integrated into those strategies by design. But then the other is, I think, at the governance level, because that's another invisible layer that we seldom appreciate. And when we talk about governance, it's beyond the policies and the strategies, it's also the enforceable legislation. And I think one of the things that struck me with the quotes that you included in the presentation was the fact that a lot of the negative and the positive feedback comes from enforceable legislation. There's no point in having a guidance or a policy that is not without teeth. And that's where people actually start to gain trust. In Thailand, you've gone really in a radical transparency to show the layers of security and privacy that exist in order to ensure that that health record is protected and only available to the end user who is accessing that record. And then I think it's also the enforceable policy And then I think the legislation around access and affordability. Years ago, almost a decade ago, we were having fights about phone number portability as a human right, right? Because the lack of affordability has led to the fact that people have to change their phone numbers every 3 months when they buy a new SIM or they buy a new disposable phone in many communities around the world. And the right to preserve your phone number was seen as an essential part of people being able to protect their identity. So I think we also need to then explore with telcos, with other stakeholders, how do we ensure that people aren't left out because they can't afford to participate in a digital economy? And so whether it's subsidization plans, whether it's minimal data packages that are available to specific populations, we're seeing different countries try different things to make sure. Because one thing you said, Meg, I just want to underline because that's really important, that digital exclusion overlaps with social marginalization. I'm rewording because I think that's close to what you said. But I think we have to recognize that that Venn diagram is almost an overlapping set of circles. And so if we want to ensure digital inclusion for everyone, we have to make sure that we're addressing marginalized populations. Those who are left out at the fringes of society are those who are left out of our digital transformation.
I guess I first want to start also with a congratulations to you and the bigger team, many in the room here, for the report. And also good luck this week with so many events. I saw you posted on LinkedIn, and I don't know how you're managing that. I think the report brings new clarity to 4 key dimensions that were spoken about in the presentation now. And those dimensions that really, I guess, pose structural threats to the health of populations in the countries where we live and their rights. I have to say, overall, the findings in the report are not a big shock to me. I think many of them are challenges. Many of the challenges that were shared are those that have been faced by key populations and young people offline for many, many years. And we're now seeing that shift progressively into online spaces. And the challenge that comes with that is that online spaces are largely unregulated. They're wild places in some platforms, some apps. And there is this challenge with anonymity that we're all really struggling to address and respond to. I think tying into your point a little bit, what really stands out in the report for me is how it connects design choice with social outcomes, health outcomes, and rights outcomes. I think that was really the standout message for me. So, where digital frameworks do not consider accountability, transparency, privacy, and consent, you actually open up a population to significant harm and significant risk. And that was really the highlight for me. So responding to this really requires a consideration of people-centered and equity-focused approaches and participatory approaches. And that's why we have so many people in the room here from communities that really need to drive this change. I guess thinking about maybe what that immediate next action needs to be, I might start a little bit smaller scale. I think this is the platform where we need to start. It's about bringing all of our different sectors together because it is a multi-sectoral challenge. We bring together very technical areas, health, human rights, and the tech sector. Each of us don't quite understand all of our areas of work. So having people to facilitate those discussions is critically important. And having young people and populations and communities in the room driving the agenda, not only participating, but leading the agenda, I think is really important.
Great. Thank you very much. I think that also deserves a round of applause. And, I think so just a year ago, we just started the study in Kenya. I came to Geneva and I met with Mike and Alan. I was in a panic because I said, you guys, we got a much bigger grant. We're doing a much bigger study and all the findings are the same as our previous study. So it's all the same stuff. It's just on a larger scale. It's much more deeper data, richer data, but it is, again, digital exclusion. It is technology facilitated abuse that is now seems to be expanding, even becoming normalized, as Molly said, with very little access to redress. It's all these stigma, privacy issues. And so why is it persistent? And so what Alan and Mike said, which was brilliant, was, well, let's look in each country, what are people doing about these problems, and why is nothing changing? And so I'm going to ask you to put you on the hot seat a little bit and ask you to think about this. Why is it so hard to make progress on these issues? I have my own ideas, but would love to hear your thoughts about that. Whoever wants to go first. Ellen?
Sure. I think we are on the cosmic scale of things, always impatient optimists, right? We want to see change occur at a much faster scale than it does. We're little over 100 years out from the invention of the telephone, right? So I think we're struggling as a society to keep up with the pace of change of technology, and many of our member states are in the process of going through now their maybe second, sometimes even third digital strategy, digital blueprint, plan of action. Each time this topic area is revisited, we see an increase in sophistication, an increase in complexity. And I think it also reflects a growing sense of appreciation from the public itself, who is increasingly aware of both the positive benefits and opportunities that technology holds, as well as the risks and challenges. You just mentioned, this issue of the unclearly defined harms that people may be subjecting themselves to when they engage on social media platforms, et cetera. And I think, when we think about digital competencies, which is something we're working on at WHO, it's not just competencies thinking in the classic sense, in-service and pre-service training, but it's also public competencies. What do we as citizens living in a digital age need to know and need to practice as part of our existence in this space, right? I look in the audience and I see a mix of digital natives and non-digital natives, which, if you're not familiar with the term, it's to ask yourself, was Google search engine around when you were born or not, right? And if you've always known a Google search engine and you don't know the sound, that you're not you're a digital native. But the idea is, for those of you who are digital natives, there has to be a thinking process now in terms of what are the skills and behaviors, the digital hygiene, if you would, that we need to practice in a digital age. And I think there's a lot of conversation around the role that individuals play in cybersecurity. So we just released a report on cybersecurity risks in digital transformation. And by far, the greatest risk is not back-end backdoor portals that allow hackers to come in. It's users who use 1, 2, 3, 4, 5 as their password, or they forward a message, or they click on a link in a document that lets a virus download onto their machine. So I think there's knowledge, there's awareness, and I think our eloquent speaker from Ghana, where are you? I guess I like that. Yeah, I mean, you mentioned, right? It's not that you're victims. There's also an active space of innovation. Folks who realize these risks and are figuring out ways to address them proactively. But of course, we'll need to keep pushing the advocacy to lawmakers to strengthen that corpus of legislation that strengthens safety and helps us live in a safe society of the future. I'll just say one last word, and that's, we often hear this term, no legislation for people without people, especially the people who are affected by that legislation. I think the same applies now to innovation, right? No innovation for particular groups of people without including those groups of people. And I think that's a mindset that we all have to share as we go forward.
Thank you. In my opinion, about this, I think that maybe I think about three things. Firstly, some area may lack of the digital leader. That digital leader may need to make the decision how to go on about the digital decision making, or along with the law like that. So if the law cannot conduct as well enough, so the people in their country will not trust this platform anyway. Secondly, there is the people perception. The people's perception that they know what they know that go past in the past. So we need to change them about this logic. That what we're gonna do in the future, we not talk about in the past. About our project, what gonna do and how can they trust us. The last thing that in each project of the digital, maybe we go large, maybe many participants, many large area, many people. We can go in just like a sandbox in the area that interest in the digital transformation to make this happen and keep it on. So that is like a showcase for their country. Thank you.
I think, sorry, I think one of the reasons why, actually, to answer your question, I would say it's the same reason why why key populations and young people have poor health outcomes. It's because technology and public health systems are built for the majority. They're built for scale. And unless we make intentional effort to address inequities, to design systems that meet the needs of those most marginalized, most hard to reach, those most underserved by that majority system, we're not going to see action and we're not going to see significant change. And the only way we're really going to see that is if we make noise. We need communities, we need civil society to be funded, to continue to make noise, to have their voices heard, to be included in the dialogue, so that systems are designed for them. I think there are building on that, there are two major challenges that I think are reasons why we're not really making as rapid progress as perhaps we could have. One is, I guess, the elephant in the room, which is the kind of regulation and the design of some of our biggest IT systems and technology systems, and the fact that we have very limited ability to influence how they're designed, how they're governed, and how they're implemented. So the big social media companies. Maybe some of them are in the room here, I'm not too sure. But their systems are designed to promote controversy, to promote division, to propagate clickbait and some harmful content and norms that impact key populations and young people. So until we generate regulatory systems that address this, I don't see that we're going to create safe spaces that we can use confidently. So it's critically important that we have redress systems and kind of that short-term response in place until we've solved some of these challenges. And I think one other point I would want to make is around, I guess, funding. 2025 is a very different year than 2024. The funding landscape for health is changing. Funding landscape for tech is changing. The actors involved are changing. So I think it's going to be really difficult to think about prioritization in the next couple of months and next couple of years. So what we may need to think about more is how we're really integrating this digital rights discussion into different spaces. Traditionally, at least from what I've observed, many organizations will have a digital rights lead or digital rights team. I'm not sure that that's enough. I think there needs to be effort within organizations to sensitize the broader community within an organization so that these issues are taken more seriously at all levels of programming, at all levels of an institution, and in all policies that are being implemented or designed.
That's great. Couldn't agree more. Okay, last comment to you, then we're going to go to Cindy for the last question.
Yeah, no, I think so. One opportunity is in many countries, we're seeing the emergence of digital transformation offices or digital transformation agencies. Sometimes they're sector specific, sometimes they're broad, all of government digital transformation. Those are often the key nodes who have the opportunity to set and enforce some of these regulations and push the radical transparency that builds trust, but also enforces these issues. I mean, one very salient example we've seen where legislation has dramatically impacted the adverse use of platforms is in unauthorized AI deepfakes. Several countries have issued very draconian, intolerant laws of that particular behavior. And I can tell you that has seen a dramatic decrease in the proliferation of that type of harmful content. So effective enforceable legislation backed by a body willing to give it teeth can be a very powerful instrument.
Okay, yeah, thank you so much. And as you were speaking, all of you, not one particular person, but as you were speaking, one of the things that was coming to my mind was there was a time where I think everyone just thought about having digital platforms and digital sort of AI-based platforms as the only innovation. And we're also seeing it even with the new phone companies, not new, but like the latest phones that are coming out. We are only seeing people really prioritizing AI and putting digital apps as part of the only innovations. But I also want to challenge us that there are more innovations around it. Importantly for us is to ensure that the people who are going to access these platforms are actually safe, feel safe, and can get appropriate and can get factual information on these applications as we design them. As I go to my question, my last question to the panelists, I want to ask, what are the opportunities that are coming up in the next year or in the probable future to ensure that we can be able to work on the issues that we have talked about today?
Thank you. Because there is many changing about the digital transformation, including the AI. Becoming the AI, that the significant one is the data, of course. The data is, by the way, we really need to transform digital transformation. If each country cannot have enough transformation or cannot correct their data, so anyway they cannot go to the AI as needed, because the training data that is maybe from another country, maybe give our country data to another that is maybe not good enough. So we need to collect our data ourselves, and to maybe sometimes if it's good enough, maybe training ourselves to decrease the artificial intelligence bias. This come along with the AI governance and AI principles, along with the UK Act, like that. So to make this happen, I think that maybe a chance, as the HRP said that many countries have young adults. So I think that is maybe a chance. So we can push young adults in each country that have a problem, or maybe a key population that interest in the digital transformation like this, to come with us and train them and make them to like a digital leader in their country, so they can lead their own country, can lead their project in their own country, because they know that what do they need for their country. So if I think that is may cause it go on by these people, because this is one thing that's why digital transformation cannot change in the past, because we not change the head, we not change the leader. So I think in this area, many young people here. So and I think that people here is interested in the digital health like that. So we maybe like community, youth community assembly like that, and WHO maybe push this or maybe bet fund on it. I think this is can be changed.
I got 5 things. One, global initiative on digital health. This is our collective initiative. It's not WHO. We launched the initiative as a platform for this exact kind of cross-sectoral dialogue. It's an opportunity in 14th through 18th of July. We're having our next annual convening, and we would love for this to be a major thematic area where we bring together other parts of the sector that we've heard about today, policymakers and planners and even the private sector. The second is the global strategy on digital health. For those of you who aren't aware of what this is, it is a member state document. So your governments from wherever you come from have all contributed to articulating the priorities for digital health and digital transformation that they want to undertake as countries, that they would like stakeholders and the community to undertake, and that they would like WHO to undertake as a secretariat. So that document is going to be formulated for the next 5 years, 2028 to 2033, in the next year. And so your voice and your helping to drive this agenda within the global strategy is going to be very important. The third, and I just want to repeat exactly what you said, advocacy, right? There is no substitute for consistent and persistent advocacy. And I think what you started here and what you've been doing for many years is something that's phenomenal. And I think we need to continue to do that and speak out for those who can't. We had some very powerful, bold, and courageous voices here today, but there are many around the world who are marginalized and don't have that power of the microphone. So use that power. If you're in the room today, if you're in Geneva today, you have a unique capacity to speak out for those who don't have the voice. So please do that. Fourth is private sector engagement. So WHO, and I say I get flack for this every day. We maintain a platform called the Tech Task Force, where every 2 weeks we bring together Google, Meta, Facebook, X, all of the folks who we think should be at the table to hear the things that we want to hold their feet to the fire about, and make sure they are hearing from all of you and our member states the things that they can do better. And we want inputs to the Tech Task Force that we can take back and ensure that they're being responsible members of this future society. And then the last thing I'll say is youth, right? There's nothing like folks with gray hair writing legislation for those who have still a full head of hair. And I think we need to engage actively youth in all the discussions, and that's something that we in our work in digital health take very, very seriously. I'm from Bangladesh, so I'll end with Rabindranath Tagore, who's one of our great poets, said, don't create the future for your children because they come from a different time. And I think we have to. That's why engaging youth is so important. Making sure that their perspectives are reflected and not our prejudices in how we create the world for them.
I guess I'll start by just saying that the Global Fund will continue investing in the digital transformation of healthcare provision to enable greater access to health services. What that looks like will be determined by countries through our grant cycle. But we've shown that we are committed to this. We've invested around $150 million a year in the digital transformation. And to date, over $300 million in human rights programming. So we're going to continue doing this. I would say as an initial step, if you are based in a country, to connect with our human rights implementers, let them know of the challenges that are being faced by you, key populations and young people in the room, and by your peers and by your community, so that they're aware and they're able to provide the right support and right services. In terms of our digital health side, we are going through the process, or we're about to start the process of revising our digital framework. And there will be partner consultations as part of that process. So many of you will probably receive an email at some point, likely to be Q3 this year. So watch this space. But that really has guided a lot of our work. So it is important that you are engaged in that process if you want to be. In terms of the digital health within the Global Fund's guidance and model, there are many strong advocates in the room that have been advocating to me and my peers at the Global Fund, and I am pleased to say that digital rights will have greater prominence in our future documents. So I'm happy about that as well. So that should be released sometime later this year. And then I guess just one final point that I really wanted to highlight, one of the important partnerships that we have been building over time, which is our partnership with Thomson Reuters Foundation. So working with the media to try and address some of the big challenges that have come up today, misinformation being one, addressing or thinking about how AI is used. And that is specifically working with young people to try and challenge misinformation and disinformation online. So we would really love to continue working with new media and old media across the countries where you are working, and thinking about new ways to really promote the importance of addressing digital rights issues as we roll out this digital transformation.
Thank you very much. And let's all join in supporting the Global Fund. Hope for a very strong replenishment this year. So I'm getting alarmed messages from all my colleagues because the guy who does the closing remarks has to leave by 6:30. So we have a hard stop 6:30. You will definitely have a drink and a snack. So hang in there. We're going to do a round of questions. We'll do a quick fire reply, and then we'll move on to our last couple things. So I believe we have first question from DTH Lab. And so make sure they get a microphone, and then I see a hand in the back there. And looking to Javier to flag if there are questions online, and a hand here. Okay, so DTH Lab first, and then we'll continue on. Thanks. So we're just going to do the round of questions, and then give you a chance to think about your answers, please.
Hi, thanks a lot for giving me the floor. It's not a question, but rather an intervention that was supposed to be delivered by Aphrodita Bruchicki, the executive director of DTH Lab, but she couldn't make it because she twisted her ankle. Anyway, I'm going to speak on behalf of her. I'm Dr. Saman Khan. I'm a medical doctor based in India, and I'm the regional youth champion for Central and Southern Asia at this cohort. So our comments are as follows. DHRP's new report clearly argues that we cannot afford to reproduce offline inequities online. Digital forces are shaping our health, and particularly that of young people, in profound and complex ways. With children and young people living ever more connected lives, prevention of digital harms must keep pace with expanding digital opportunity. At DTH Lab, our team is mapping policies and regulations worldwide to protect young people from digital harms, and found a striking lack of involvement of the health ministries and young people in shaping these policies. Current legislation focuses on sexual exploitation, abuse, and cyberbullying, while risks such as addictive design, misleading marketing, exposure to violent or extremist content, and their physical and mental health impacts go unaddressed, unfortunately. In the coming days, WHO European Office will launch a new policy brief in collaboration with DTH Lab and the Polish Ministry of Health. We are calling for the digital determinants of young people's health and well-being to be addressed as a public health priority, and set out some recommendations for how to do this. A key cross-cutting recommendation is that young people must have an active role in shaping policies and interventions aimed at creating safe, healthy, and rights-respecting digital environments. We must increase digital literacy, and user empowerment should be significantly strengthened. The DHRP study, Paying the Costs of Connection, echoes this, calling for investment in the resilience and leadership of the young people. Youth, majorly in lower and middle income countries, face a double disadvantage under resource health systems, as well as patchy digital access. As one of our former regional youth champions reminds us, open quote, children and young people are not just passive users of technology, they are digital natives. Yet policies shaping these technologies are often developed without their input, close quote. Rights-based guardrails and digital literacy cannot be afterthoughts. They must evolve with technology and funding, with young people and health ministries in decision-making roles. Thank you for your time.
Thank you so much, DTH Lab. And so for everyone else, we're going to expect you to ask a question. Room is flagging. People are hot and tired. we've kept their patience as long as we could, so please keep it a short, brief, to the point question. Yes, please. Well, the colleague here in the green blazer, this gentleman here, and then we'll go online. Thanks.
Thank you so much, Esther Kishmudi from SRHM. Just a quick question. We talked about a lot about harm, privacy, how to address both from the research, policy, regulatory perspective, ideology-based censorship, especially in relation to sexuality, sexual health-related content. Did you come across from research, and how WHO is dealing with partners on that we are experiencing increasingly in the digital space?
Great, thank you. Excellent question about censorship of sexual and reproductive health information. Please.
Yeah, quick question. The decade of 90s saw the rapid computerization of everything. Means there were fax machines and everything was given up, and the first decade of this century saw emergence of digitalization, like our finances, banking, and this. But it was accompanied by some misuse also, like cyber frauds, financial frauds, even leading to some very dire consequences. I heard very carefully that the regulation is good, but regulation should not be over-regulation so as to prevent the acceleration of adoption of the technology. So my question is, how do you balance? Means we are still in the earlier stages of this technology really going wide. But how do you balance regulation versus real expansion?
Okay, great. Thank you. How to balance regulation against innovation. And online, do you have a microphone? Or thank you, Juliet.
Yeah, thank you. So we have a couple of questions online. I'm going to start with the question.
Let's do two.
Let's do two? Okay.
Yeah.
Yeah, so Alia Jacinda, I'm sorry if I mispronounce your name, was just saying that perhaps this question has been already partially asked or answered by now, but I'm going to ask it anyway, right? And the question is to the panelists, what is a key takeaway from the research findings and today's discussion? Concretely, is there anything that you will be doing differently in your work on the basis of the findings and or recommendations? That's the first question. The second question is by Robin Montgomery, and it's quite a long one. So
maybe you can summarize it. Yeah, thanks.
I will try.
Okay.
Robin Montgomery is first thanking you for this thought-provoking session, agreeing with the speakers about the focus on sustainable investment in AI and digital health, but also answering critically of ongoing investments in community data and so on. He would like to, following on to the speakers who have raised the serious issue of ethical, regulatory, and inclusive governance systems, accountability mechanisms, and inclusive design, implementation, monitoring, and oversight of digital strategies and tools. This is a multi-sectoral and multi-stakeholder urgent call to action. This report and today's event is extremely welcome and incredibly timely. And I wonder how and what our esteemed panelists foresee as the immediate necessary steps to ensure that all the stakeholders at the table, including big tech companies, government, academics, ethicists, communities, and civil society, can do on this. Thank you.
Thank you so much, Javier. So we have a question about dealing with censorship of sexual and reproductive health information, a question about balancing regulation against innovation, and then some questions about specific next steps and specific actions. So maybe we'll just go across and you can just pick the questions you want, and then we'll move on. Thank you.
Thanks, and I guess I don't have an answer to all of these questions, but I would build on the question around censorship or removal of sexual reproductive health content, because I think there's two elements to that. One is, I guess, more of a state-sanctioned approach of removing content or censoring content, and the other is more of a passive approach that's happening on social media, where specific content is automatically flagged and removed, and that really relates to a lot of work on sexual health, reproductive health, LGBTQI+ rights and health, and particularly women's health. It comes down to the images that you use and the language that you use. And these are really difficult things to tackle. I don't quite have the answer to them. On the what we're going to be doing based on the findings of this report, I think there are two key things. One is that we have now taken digital rights into our guidance for the next grant cycle. So there will be a greater focus, as I mentioned. And that really comes from the evidence that has been collected through studies like this, as well as many other studies that have existed beforehand. The other is also somewhat related to the findings of this, but also based on experience and what we hear from our youth council, from our constituencies on our board, and from key populations and communities that we engage with, that there are serious safety concerns with the use of technologies, but also engagement of health services. So I think we're going to make sure that we have a much greater focus from recently and moving forward on addressing safety and security concerns, both from implementers and users of technology, as well as clients of health services. And that would include digital security and safety as well.
No presentation.
Having woken up at 5 a.m.
No presentation.
I'm losing the last brain cell that's still active. So I'll answer the two questions that I remember from the 6th. So WHO is very clear. Sexual rights of all, especially sexual and gender minorities, must be protected and fulfilled. And so there's no ambiguity in that statement. It's very clear. Member states choose to implement, enforce, and develop policies that are specific to their context and environment. We continue to advocate for justice. We continue to advocate for the statement that was just said. And I think what we can do is continue to promote, exactly as you said, robust research, advance the science, and ensure that countries have the science-informed guidance at their fingertips on which to base future decisions. So that's the best we can do as a multilateral apex, science and health agency. I just want to call out the DTH labs. I think there's a really interesting piece of work that they did under the Lancet and Financial Times Commission called Growing Up in a Digital World 2030. And part of that effort was to ask young people to describe the future that they would like to see in prose, narrative prose. And we're in the process of launching, hopefully, a film festival that will take that to the next level and create visual representations of those images of the future. And I think that's one way for us to incorporate digital health and rights into that future vision, challenging people not just to think about the shiny objects that they want to see and the navigation, but also to think about the way in which their information, their digital journeys are safe and protected. And so we're going to challenge them to incorporate that into the way they visualize the future.
Thank you. In conclusion, I think that we discussed today I think there's four major things. First is about the capability building for both health professionals and local communities. I think that in this way that more detail, that means we can provide another young generation to promote this digital transformation. In some area, like for example, like Thailand, we have the community volunteers. So we these people close to the people in their communities. So they can discuss, they can give the information with true information. So the perception of people in their community can have a good perception about digital transformation or about healthcare information. In Thailand, we call these people OSMO. So this can contact with the people in their area. We have these people much enough in the country, or maybe we just start in just a small community. Secondly, we should develop the standardized health database and robust data protection system. In Thai, we have protecting data act. So we have this act to control the data usage and data sharing or data processing like that. So they have some punishment if the leak of this data. So I saw in the World Health Assembly and I like it that it's called My Health is My Right. And thirdly is the investment in digital and physical infrastructure. And lastly is the policy and advancement and legal reform in each country.
Thank you. Great. Please join me in thanking all three of our esteemed panelists and my co-chair, Cindy and Meza. So thank you very much, Alice, Alan, and Dr. Adityan. I'll now pass to Alan Maleche to speed us towards the conclusion so that we don't lose UNDP. Please,
So thank you. I know we are about to start disappearing, but there's two more exciting things that are about to happen around a spoken word and also launching a campaign. But before we do that, we quickly have to hear from Manish of UNDP because he has another engagement. And it's unorthodox to give closing remarks and then continue, but we have to adapt to the circumstances. So we are getting him on, but once we have him on, he'll quickly give his closing remarks, and then we will be able to get a spoken word from one of our colleagues in the community, and then eventually close with the launch of our Make It Safe campaign, and then we'll all be welcome to snacks and drinks and more conversations on the exciting topics. So we turn over to Manish.
Thank you, Alan. I hope I'm audible and visible.
Wait. Audible, you are visible, you'll get there. So let's wait.
I ought to be because we tested the system at the beginning, so I should be visible soon.
You are now.
Should I start or?
Yes, go for it. You're visible, you're audible. Over to you.
Perfect. No, thank you very much. I want to start by thanking Meg and everyone. You know, this has been truly a meaningful session for me. The stories and evidence we have heard today, they are a clear reminder of digital transformation of health is not just about technology. As I always like to say, it's about people, rights, dignity. The reports finding that were presented, you know, they underline both opportunities and the harms that digital technologies can bring to young adults, particularly those from marginalized communities. Digital divides, online abuse, real fears around privacy and safety are barriers that prevent many people from accessing care and information that they need. One striking takeaway for me was when Meg presented that 3/4 of the young people in the study reported some form of technology facilitated abuse, which was quite amazing to hear. Many didn't feel safe, they sought help, they were worried about being criminalized or judged or ignored. But as she was presenting, what stood out for me was equally the determination of these young people who took part in the studies, you know, and their voices compel us to do better. UNDP earlier this month released the Human Development Report, and it focused on artificial intelligence, a new digital technology. Well, not really new, but the report is very interesting, and I urge everyone to read it. One of the things, it basically talks about how the future of AI depends on the human choices, the choices that humans we make. And one of the things very pertinent for this discussion is that AI is not going to be neutral because it reflects the values, biases, and the power structures of those who design it. One example that we are seeing pertinent again to this discussion is that mental health is emerging quite significantly in younger population. particularly in the 18 to 24 age group. Their mental well-being scores are much lower than what they used to be. And a lot of this is being linked with smartphone use and underscored by how AI-driven platforms, they can shape cognition, emotional and social interaction. Often invisibly, the recommender system in the AI leads to a lot of these mental stress issues. And the report also urges, something similar to what has been discussed here, to embed transparency, human agency, and consent into algorithmic health tools, which is not just making them ethical, but also making them more trustworthy. At UNDP, we always believe that digital health must be built on principles of equity, human rights, and inclusion, without the technology risking more harm. We have a Digital Health for Development Hub where we help work with WHO and partners and countries to make digital health more accessible, safer, and fairer. But also, let's be clear from what we have heard today that young people are not just users of digital health technologies, they are leaders, they are advocates, they are change makers. The strength and insight that they bring into this space is remarkable. And this has been my personal professional experience of the last 20 years working with young people in HIV and other public health programs. I strongly believe that we need to invest in their leadership to make sure that they have a say in shaping digital systems which affect them the most. They are the users. They have to have a place in the design of the technologies. And finally, let me close by thanking Meg and her team and all the participants in the panel discussion for this important research. We learned a lot. At UNDP, we remain committed to working with all of you in advancing digital health governance, which is inclusive, rights-based, and grounded in local leadership. Thank you once again, and looking forward to more such discussions. Over to you, Ellen.
Thank you, Manish, from UNDP, also co-sponsors of this event today. We appreciate the closing remarks and the warm partnership that we enjoy with UNDP. I will quickly move to the two last exciting segments that are not slides or PowerPoints or panel presentations, but it is a spoken word from one of our Colombia Community Advisory Group team member, Cindy Marcela Zapata, will give a spoken word piece. The performance will be in Spanish, but luckily the translation will be on screen. And for those who understand and speak Spanish, enjoy. Over to you, Marcela.
Antes de empezar, quiero tomar unos minutos para agradecer.
Before I begin, I want to take some minutes to thank you.
Gracias a quienes
Thanks
hicieron posible este espacio,
to everyone who opened this space for me.
a quienes han caminado conmigo y
Those of us who have walked with me,
a quienes sin saberlo me han
and those of us who, without knowing, have inspired me.
Nací mujer.
I was born a woman.
Soy hija de una mujer que vive con VIH.
I am the daughter of someone who is living with HIV.
Esto ha significado para mí
And that has meant feeling
sentir la discriminación
the weight of discrimination from the earliest years of my life.
He crecido bajo la sombra.
I've grown up in the shadow of invisible numbers,
Esas que no se cuentan.
those that are never counted.
Soy parte de un
I'm
número
part of a
que
statistic
prefieren ignorar.
many choose to ignore.
El de hijos e
The
hijas
children of women
de
living with
mujeres que viven
HIV
con
women
VIH.
around the world.
Y esa realidad ha sido
And that really has
la
become my
liderazgo
greatest
social.
motivation to lead social change.
Por eso estoy aquí.
That's why I'm here.
¿Te has preguntado
Have
alguna
you ever
vez
wondered how many people around the world deeply love someone living with HIV?
cuántas personas en el mundo amamos a alguien que vive con VIH o ha muerto a causa de
Or
ese
someone who has died from it?
Estoy segura que
I'm
somos
sure
muchos.
there are many of us.
El VIH,
HIV,
tres palabras que durante
three
décadas
letters that for decades have carried the burden of stigma,
discriminación
discrimination,
y discursos
and
de
hate
odio.
speech.
Hoy, ese juicio
Today,
también
that judgment
en
also
el
moved
mundo
into the
digital.
digital world.
donde muchas
where
personas
many people face online
enfrentan
violence,
violencias en línea, acoso y discriminación.
harassment, and discrimination.
La
The
feminización del
feminization of HIV is
no es
not just
solo
a
una
statistic in
estadística de
epidemiological reports.
es una
It is
realidad.
a living reality.
Ser mujer y vivir
Being a
bajo
woman
violencia
living with HIV
muchas veces significa
often means not having access to
no tener
healthcare,
acceso a la salud,
to information,
a la información y a una vida
or
digital
to a digital
libre de
life free
violencias.
from violence.
La juventud es la fuerza
Youth is
humana.
the force that transforms.
Somos el presente,
We are the present,
un futuro
demanding
más
a more
justo,
just
donde
future,
los derechos
where
digitales
digital rights are for everyone.
Hoy te invito a ser
Today,
parte del
I
cambio.
invite you to be a part of the change.
Únete a la campaña
Join the
de
Make It
Safe
Safe
y
campaign
construyamos juntos
and let us build
un
a
espacio
safe
digital
digital
seguro para
space
todos.
for all. Gracias.
Sorry. It's not your fault.
Gracias, Cindy.
Thank
Very
you, Cindy.
words spoken to us from one of our members from Colombia, the Community Advisory Group. So I'd like us to go to the last action for today, which we spoke about when we began, that we want to officially launch the Global Digital Campaign. And the details are available. Again, there's a barcode that you could scan to give you information. The campaign is called Make It Safe. It's launched by our community advisory teams in Ghana. You heard from Solomon, you've heard from Cindy, and we also had a good moderator from Kenya who is also part of the community advisory team, and our colleagues from Vietnam who are not in the room due to the usual visa challenges. And so the community advisory team that has been driving and shaping the research and advocacy wants to drive a campaign that involves all of us, and they call it Make It Safe campaign. I will just point out the three key issues it brings, and it's calling leaders, all leaders together across the globe to act. They'd want you to close the gap in digital access and tech facilitated harms, and ensure young people have a voice in shaping digital health governance. And so over the next few weeks through this campaign, we will be sharing youth stories and calls for action. I kindly request you on behalf of our community advisory teams to please sign on to the link. Once you scan the barcode, it takes you onto a link, and you'll see a pledge that you're making towards ending tech violence, increasing digital access, and all the other recommendations that have been made in this particular report as we work towards making the world and the work that we do together to create safer, more just digital spaces and make it safe online for everyone. So could we get a round of applause for this group? And please, we will check whether you signed the pledges against the attendance list, so kindly do so. But on a more serious note, it is a very important campaign that is quite helpful for us to really walk the talk and talk about the action that we've talked about. I believe that now marks the end of our forum, and I'd like to greatly thank all the panelists. I'd like to thank all the co-sponsors whose logos appear on there, including UNDP. And I'd like to encourage you to get copies of the report, share them online. Let's keep the conversations going. I know there were questions online that were not reached, but we will take time to reflect on them and get back to those who raised them. But a big round of applause to the audience for staying through to the end. And now I do welcome you for a social event and continuing the conversation. Thank you for being with us.
Thank you very much. We have drinks and snacks out here in the reception, so please join us. Thanks.
Thank you. That was very difficult. No, easy.
for a quick photo.
Yes.